Hi everyone, again one more video I would like to say is which is very common and students are facing a lot of problems related to that aspect, that is the writing part. Many students they are facing having a doubt whether in a writing a non-case, especially when they are mentioning about the families GP and then patient is not there. Until unless there is a patient's GP or patient's family's GP. If the patient is already mentioned along with the family or GP or whatever physician, whatever things is mentioned along with the patient, if it is coming, it is considered as a non-case. I have discussed with many of my colleagues as well as with my friends and all. What I have seen is they are mentioning like in a different way, and many centers also from my students that they have experienced that they are explaining it's a wrong way and that is not the one. And afterwards when they are analyzing, right, and they are seeing that they are doing the mistakes. So please try to avoid this kind of mistake, and wherever you are getting the question related to the non-case in a letter writing, whenever GP is mentioned, it is not a non-case. Okay, every time there should be the patient's GP, that word should be there exactly. In case if it is not there, it's fine, try to calm down and go and check with the setting part where the patient is going to refer and patient address. Every time you need to look towards that. And again these days they are putting more of the tricky things, so what you can do is, if the address is also kind of tricky one, what you need to look also in the letter writing is you should look to the setting again. That setting is not the referral and the patient address. Okay, there are the certain things, that is home nursing, rehabilitation. This is kind of long-term care. So if the patient is in the long-term care, especially Parkinson's disease, asthma disease, right, they need a long care like a cirrhosis of liver and many deformities. They need a long-term care. So obviously if their setting is from the home nurse or rehabilitation, there is a possibility of having a non-case. At that time what you need to look is, okay, home nurse is there. Now second thing what you should do is you should go back and check the patient address and referral address. If both are matching and similar, you can take down as a non-case. This is the second thing. And now last thing what I can say is patient once again. Okay, patient's GP should be there. GP doesn't mean that it is a non-case until and unless patient's GP or Mr. John's GP it is mentioned clearly, means you can take. And many times what students are facing is what I have said in the initial, similar to that. What students are facing is when they are mentioning about the family or school nurse, right? School nurse doesn't mean that it is a non-case. Okay, please don't do that mistake. Many are doing that so commonly, okay, among my students. So that's why I'm putting in this video. School nurse is not a non-case, not at all. Okay, if your center is teaching you that it is a non-case, please try to avoid and try to discuss with the teachers, tutors about the whether it's right or wrong. From my videos that you have seen that it is wrong, you can say that to them and they will analyze. Okay, so why I'm saying is that it is not a non-case. School nurse doesn't mean that if I'm in a school, right, how they can say that nurse is knowing my things. It's not possible. Their documentation will be there. Yeah, many are saying that documentation will be there, but they don't know much about my conditions and all. Maybe I was not sick at all and my condition was totally new. Until and unless school nurse, and my name is Dolma, right? Dolma's GP, Dolma's school nurse. If it is mentioned, that is only the non-case. You cannot write beyond that and you will get trapped. Okay, you will lose the marks as well and you will end up with many big issues in the OET writing. So please be careful. This is my tips for today and I wish you all the best for all the learners, and catch you in next videos. Thank you so much.